Meet Arian. He is an 11-year-old boy, physically frail and quiet, standing utterly still while the world rushes past. It is Monday morning. The school machinery has already started turning, demanding strict punctuality, order, and total focus from every student in the building. But a deeply unsettling, vivid dream from the night before has hijacked Arian's nervous system, leaving him paralyzed by severe morning anxiety. For a child like him, the real test of school has nothing to do with the curriculum. The primary challenge is simply surviving the daily war between his mounting internal dread and these unforgiving external obligations. Arriving late to the campus, Arian makes a deliberate choice to abandon his first period English class altogether. He heads straight for the school library, a destination he has chosen specifically for its heavy, tightly regulated silence. He retreats to the very last desk in the darkest corner of the room, attempting to build a physical wall between himself and the relentless demands of the school day. Picking up a science and technology magazine, he tries to absorb its objective, logical facts to drown out the subjective, emotional noise ringing in his head. Arian uses the library as a psychological quarantine, an essential maneuver to stop his internal chaos from spilling into reality. The sheer exhaustion of navigating his morning anxiety finally catches up to him. He closes his eyes and rests his heavy head directly on the magazine. Suddenly, a voice cuts through the silence. It is a crystal-clear hallucination pleading, "Please, Mr. Hogan, I can't take another defeat." Arian's head snaps up. The shock jolts through his body, exactly as if he had been struck by a sudden electrical current. This animated diagram shows the physiological cascade of his panic response. Blood vessels in the extremities rapidly constrict, dropping his core temperature. The muscles lock into place. Arian realizes with terror he has been trapped in this rigid, catatonic state for 30 minutes. His psychological distress has successfully breached the physical world, fully incapacitating him and erasing the last remaining boundary between his private nightmares and the room he is sitting in. To fight back, Arian deploys his first deliberate anchor to reality. He checks the watch on his left wrist to verify the exact objective time, 10:21 a.m. Next, he initiates a secondary physical grounding action. He opens his bag and takes precisely 3 sips of water to force a reset of his nervous system. He did not invent these steps on the spot. He is initiating a strict 2-minute mental rest exercise, carefully prescribed by his doctor. This flowchart maps out cognitive anchoring. It demonstrates how sequential sensory inputs, like checking time and hydrating, successfully block a looping panic signal. Expanding the chart reveals the broader context. Arian relies on active psychiatric care and daily medication simply to function. Arian survives by actively deploying these clinical tools, a disciplined patient managing his recovery in real time. With his panic successfully interrupted, Arian finds a sudden burst of physical momentum. He sprints up the stairs to the 4th floor, completely ignoring the elevator. His destination is the science classroom. It is an environment ruled by a strict teacher named Diwakar, but one that remains remarkably open, honest, and engaging. Arian slips into the late lecture, experiencing a rare moment of good luck when he realizes the teacher was also momentarily delayed. Compare his earlier descent into the quiet isolation of the library with this active, upward climb. He is moving toward a subject that brings objective clarity to his chaotic internal world. The routine of the class breaks when Diwakar Sir makes a sudden announcement. The school is hosting an upcoming campus-wide speech competition. Normally, Arian's default behavioral pattern kicks in during these events. He shrinks away, desperate to avoid any external scrutiny or mounting pressure. Then, the teacher reveals the specific topic assigned to the science department: evolution and mankind. This specific subject instantly bypasses his anxiety. It speaks directly to his profound internal passion and his deep personal understanding of the scientific world. While his invisible burden remains, this specific subject offers a point of alignment, an opening where his internal passion might finally be strong enough to pull him toward the world outside.